from the Psych Hub Podcast Network.
Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub Podcast, The Future of Mental Health.
Welcome, Madam Secretary. We're so honored that you can join us for this podcast. For those who aren't familiar, SAMHSA is the Substance Abuse and Mental Health Services Administration. It is the specific office within Health and Human Services focused on being very proactive in advocating for issues regarding mental health and addiction care. So it was really seen by Congress and the federal government that there needed to be a place that really gave the attention and voice for issues of mental health and addiction. So in that respect, we have been so grateful for SAMHSA. But we're in the midst of a real transformation now, which is why having Assistant Secretary Delphin-Rittmon here today is so important, because now we're seeing mental health being emphasized across the healthcare space. So what we'd like to talk about today with the person who's leading this effort on behalf of SAMHSA is how they see the role of SAMHSA evolving. How do we use SAMHSA as a force to integrate mental health the way it ultimately ought to be integrated now that we have this great appreciation that there is no health without mental health? So, Marjorie, I'll let you do the official introduction of our guest.
That was a great background, Patrick, because I think so many people don't know about SAMHSA, and everyone, especially with the pandemic, knows about HHS and Health and Human Services. But you're absolutely right. I mean, when we talked about a mental health crisis and everything that's going on, so much of this really cutting edge work and research and arm around that comes out of SAMHSA. So we couldn't be any happier to have Dr. Miriam Delphin-Rittmon, Assistant Secretary for Mental Health and Substance Use, SAMHSA, at the U.S. Department of Health and Human Services with us today. So prior to her current appointment, Dr. Delphin-Rittmon was the adjunct associate professor at Yale University, where she served on the faculty for the past 20 years. Through her 20 years in the behavioral health field, she has extensive experience in design, evaluation, and administration of mental health, substance use, and prevention services and systems, and has received numerous awards for advancing policy in these areas. So I have no doubt that we are going to be learning a lot from her today. So thank you so much for joining us, and we can just dive right in. Why don't you tell us a little bit about your background and a little bit just about your work experience and what got you to this place?
Yeah. I just first want to say, thank you, Marjorie and Patrick, for having me on. Just such a wonderful opportunity. Looking forward to our conversation and just sharing about the work of SAMHSA and some of what we're seeing and hoping for as we're looking forward in terms of mental health for the country. So in terms of my background, I'm a clinical community psychologist by training, and prior to my current role as Assistant Secretary, I was a commissioner of the Connecticut Department of Mental Health and Addiction Services. I did that role for about 6 years, but also had an appointment at Yale. And so have just loved working in the space where I'm looking at the intersection of sort of research and policy and system design and development and bringing those sort of spheres in that work together. And so I feel so fortunate that in many ways, I get to look at some of those very same areas now from a national perspective and get to think about sort of research, but also policy and how to make a significant impact during this challenging time. I mean, certainly the last 2 years has been such a challenging time for the country.
Obviously, right now, our biggest dilemma is how do we meet the need? Access is so driven by the amount of workforce and available providers, and that we're in desperate need of. Could you share a little bit about what the administration's goals are in really upscaling our reach in both the provider space within the Manpower Support Act, as well as maybe in the practitioner space? The peer certification, the coaching, and things of that sort, so we can give our listeners a sense of the transformation that's now upon us in meeting this crisis.
Yeah, absolutely. So, it's a challenging time in terms of workforce. We're hearing across the board that states and communities are having a hard time hiring the appropriate workforce that they need to carry out and implement programs. This is a priority both for SAMHSA, but the president mentioned it in the State of the Union, a real goal of the administration, especially now, as we're seeing shortages across the health professions as well as other professions as well. But a goal is really to shore up and to build up the healthcare workforce. Certainly, I'll speak in terms of SAMHSA. In terms of the behavioral health workforce, one of the things that we're really excited about is developing a peer certification program to help expand the peer workforce. I've seen the real value that the peer workforce can bring in terms of connecting people to services and supports and helping to give people hope. Often a recovery support specialist, they'll share their own experiences of recovery. And for individuals that are struggling, that so helps to give them hope and helps them to really feel and believe that they can make it to the other side of their challenges or live meaningful lives, full, whole, meaningful lives, despite their challenges. So we're excited about that initiative. We certainly are looking to use a participatory action approach there. We are looking to incorporate the voices and experiences of individuals with lived experience, even as we're developing, and especially as we're developing that certification program.
So, as you know, I had the honor of writing the Mental Health Parity and Addiction Equity Act, which, thanks to your colleague, Secretary Marty Walsh over in Department of Labor, we're finally getting this administration to really lean in on enforcement. And both you at SAMHSA and HHS and Treasury really have joined with DOL and their oversight of EPSA, the Employee Benefits Security Administration, which oversees all ERISA plans, which constitute pretty much 80% of the commercial market out there, that payers have been woefully short of their compliance with the Mental Health Parity and Addiction Equity Act, which, to remind our listeners, really requires that they cover mental health and addiction services in the same way they would cover medical and surgical care. I can tell you, we are in a position now, Madam Secretary, to really engage the payers because we really don't have the workforce. And because we don't have the workforce, they are going to be stuck between a rock and a hard place, which means they will not come up as meeting their obligations under parity, because parity includes what are known as non-quantitative treatment limits, which are what the provider network is. Is it sufficient to meet the access needs? And anybody listening to our podcast knows that right now they have to wait a whole lot longer for in-network care than they would if it were some other area of healthcare. So what I want to hear from you is, what are the ways for us to really ramp up this workforce? We have to pay more for providers so that they go into this space. We have to bring providers that may be retired out from retirement to help us meet the need. We have to manage to repurpose our existing healthcare workforce. We have to use community assets, to your experience, and train our teachers to help us, train other professions that have a huge role to play in delivery of mental health, but may not be seen as mental health practitioners. And I believe we could get the insurance companies to really support this because they have an existential need, is why I'm saying this, to help us find the path forward in getting a bigger workforce.
Yeah, I think all of that is right on. And I do have to, just thank you for your leadership in this space and for helping to write that transformative legislation and law. We know that mental health is a critical part of health. And so it is vital that we have a workforce that is poised and ready to meet the growing need that we're seeing. And so it does mean that now more than ever, it's critical that we're innovative, that we think about ways to bring all the different individuals that you mentioned to the table to perhaps be part of the healthcare workforce. And then it means also continue to bring insurers to the table to have conversations around how behavioral health providers and both mental health and substance use will be funded and supported equitably for the care that they're providing. And so all of that, I think, is the critical conversation that we're having now. One thing that the SAMHSA is doing in terms of further increasing the workforce is, looking to expand our fellowship programs. And our interest is to increase the numbers of master's level behavioral health providers. So across nursing, psychiatry, psychology, counseling. And so to really increase the pool of providers there, that's one piece. But as you mentioned, it's also important to find innovative ways to grow the behavioral health workforce within school settings or within community settings. Paraprofessional and peer providers, I think, are critical. We know there's a significant shortage of children's psychiatrists, psychologists, counselors, just across the board, children's behavioral health professionals. And so that's an additional area where we really need to focus our attention in terms of helping to expand and really shore up that workforce.
So, Madam Secretary, I want to really help you in this effort. And what I think we need to have our wish list really defined in a big, big way. So I would love to work with you and our friend Tom Coderre and Anita and others. I served with Ron Wyden when he was in the House from Oregon. Now he's one of the most powerful members of the Congress as chair of the Senate Finance Committee. He's very bipartisan, works with Mike Crapo. I really think they're prepared to go big, but we're going to need to facilitate it for them. We're going to need to map out all of these programs, like you said, the Minority Fellowship Program, and specifically talk about what kind of investment's going to be needed to really blow out this space. I really believe, as I said, the payers, they often complain to me because they don't think Parity was fair. They think they're now backed into a corner. They don't like getting penalized. And they're basically set up right now for failure because they can't get the workforce. So what I'm saying is, I think if we could get the American health insurance plans to go to Senator Wyden, Chairman Wyden, and say, we will help you find the revenue to really support blowing out these programs, not only in terms of the long-term pipeline, but exactly what you just spoke about, Madam Secretary. How do we just upskill existing licensed providers to give us more force multiplication in terms of the delivery of care today? We need to put this plan together. And as a former Paul, I can sense that there's an opportunity for a big deal. And I want us not to miss this opportunity to get something big for this space because of the tragedy of this human crisis that we're facing of our mental health and addiction, numbers in the pandemic that Surgeon General Vivek Murthy has outlined, especially with kids. So could you talk a little bit about how we could prepare, maybe in conjunction with HHS, a real map of, the Manpower Act, they talk about graduate medical education for all other areas of medicine, but it's really short shrift on mental health. And as you know, the psychologists never been able to make it in there, which is just, in this face of this crisis, doesn't make any sense. Rewrite that bill, frankly. And I'd love to see a draft written because I really think we could get it passed in this current environment.
Yeah, such important work, really, all of the above. In terms of HHS, this is a priority within HHS as well. Both looking at the workforce piece. In fact, I co-chair the Behavioral Health Coordinating Council along with Admiral Levine. And so that council has a number of priority areas. And one of those priority areas includes workforce. We actually see workforce as it's cross-cutting. So all of the different subcommittees of the Behavioral Health Coordinating Council. So there's a subcommittee committee addressing children and youth behavioral health, a subcommittee addressing preventing overdose, integrating primary care and behavioral health, enhancing suicide prevention and crisis care. All of those subcommittees have workforce components. But this is such an important area, as you've mentioned, that we now have formed a separate subcommittee that is looking just at workforce as it relates to all of those areas and other areas as well. And some of what we see as critical is certainly collaborating across HHS, but also having those important and critical conversations across government. And so continuing the work with our federal partners that are steeped in this work as well. because now is the moment. As you mentioned, it's just a challenging time in terms of behavioral health, and we can make impacts in terms of expanding the workforce. We have tools and strategies that we know can help to expand that workforce. And so we're committed there. And we are absolutely interested in having ongoing and further conversations around how we can continue to build out this work. It's going to take all of us, really, in terms of continuing to expand the workforce.
Well, thank you for your leadership on this. Whatever it is that we can do to help push this out, we are behind your efforts, 100%. And I literally think we could get AHIP. I think we could use their fear of their liabilities to actually get them to step forward and really help us push out a very bold agenda for filling the pipeline for the future, because there's no way we're going to have the workforce needed to meet the need, just as we don't today, if we're not going to do something pretty dramatic, really within the next year to respond to the crisis.
Yeah, I mean, the needs are strong. And in fact, HRSA, to your very point, Patrick, HRSA put out a report recently that by 2025, we could be as much as 10,000 FTEs short in terms of healthcare providers. It really highlights the fact that the shortages are there, not only in the health profession shortage areas, but really across the board. And so this is an important priority area now.
And the work you're doing with peers is really helpful, because we are going to have to really open up a new field for people that don't have as high of acute needs and that, can be supported by a peer or a coach. So that's exciting work for the space.
Yeah, thank you. And we're so excited about that. I mean, I've seen such innovations just across the country in terms of some of the work that our grantees are doing. Certainly I was aware of the work within Connecticut in my role as commissioner, but now that I'm in, assistant secretary, I get to hear about just the innovations happening across the country in terms of peer work. And so we have evidence-based models that we know people in recovery are making a meaningful impact in terms of connecting people to services and supports. So for their peers working in emergency departments, currently we have people in recovery working on and with clinical teams, helping to connect people to care, part of outreach and engagement teams, helping to, again, connect and reach people and connect people to care, part of supported employment teams, helping people get connected to employment. All of these, there's so many areas where people in recovery are making a meaningful impact in terms of connecting with people and helping people move into recovery and navigate services and supports.
Right.
As well. Yeah.
I share Patrick's enthusiasm in that, we've been fighting this fight for a while, and having someone who's been in mental health for decades, it is an exciting time. It's on everyone's mind and everyone's talking about it. But I think, what Patrick's saying is so important, is that how well do we use this moment? Because how long is it going to last until something else happens that's going to take it away? And we got to move quick. And yet we have to be smart, and I just think he's spot on when he's talking about some of this advocacy stuff and what you're doing. I love how you talked about working with cross departments, with HRSA and with other ones, because it is going to take all of us. We at SAMHSA train on evidence-based practices. We upskill providers using evidence-based practices to help give them those tools so that they can act more as specialists, because burnout's a very real thing too. And we know when they do that they are able to have less burnout because they're more focused. Arthur Evans from APA is really one of the ones that's kind of helped us kind of really look at it like that, which has been great. I would love to also talk about the role that cultural relevance, cultural humility, competency, if you will, is playing right now. Almost the convergence of two different kind of issues going on, but mental health is sort of an intersection of them both, and your experience with that.
Yeah, I mean, the intersectionality there is, we're certainly seeing that in terms of, when we look at our data. So I mentioned, one of our priority areas, SAMHSA is looking at data to better understand what we're seeing in terms of people's experiences. And we are seeing that, in terms of individuals who are struggling with overdose, there are higher rates among African American and Alaska Native American Indian individuals. Or in some instances, we're seeing that youth of color are struggling with suicidal ideation. And so all of that, in addition to disparities that we saw even prior to the pandemic. But what it lets us know is that culture matters. Culture is important, that it is critical that as we think about services and programs and supports that we're attentive to culture and that grantees have the space to certainly propose evidence-based practices, but also to, as appropriate, incorporate cultural practices alongside evidence-based practices as well. And so that's something we've been having discussions about as well, and including and updating some of the language in our notice of funding opportunities. So we're excited about that because culture does make a difference and does matter. We're also having discussions about evidence-based practices. Evidence-based practices we know are so important, but practice-based evidence and community-defined evidence is also important.
Yep.
And so it's important for us to look at sort of community-based practices and community-defined evidence and incorporate those into our work and work with communities to get evidence connected to those practices so that they can become evidence-based practices. And so through the SAMHSA Office of Behavioral Health Equity, we have an initiative we call Elevate CBOs, so Elevate Community-Based Organizations. And it's about working with community-based organizations to apply for grants, to think about their data, to think about budgeting so that they can become grantees and essentially develop an evidence base for the community practices that they're implementing and seeing impacts around. So we're excited about that because we think it's an opportunity to expand the pool of practices that we see as evidence-based practices.
I love that. So it basically, if I'm understanding correctly, it's one thing to have an evidence-based practice that it's been proven with evidence to be effective, but how does that really play out in different cultures and different communities? Is that kind of where you're at, is to really look at, and then maybe communities have their own evidence-based interventions that are more fitting for that community, but might not be, spun out of an academic institution.
Exactly. And, it may be that the evidence-based practice wasn't developed or assessed, tested for effectiveness on certain cultures or certain groups. So we actually are putting out a guide that sort of addresses some of this, and we're calling it our Community Adaptations of Evidence-Based Practice, something like that, titled something like that. But essentially it's about adapting evidence-based practices to be more culturally responsive. Such that there's still elements and key components of the practice, but space to also incorporate the worldview and cultural beliefs and values of individuals that would be accessing the service or support.
Anything we can do to help you with that, as you know, Madam Secretary, there is a great interest finally in social determinants of health. And we need to take this moment also to get investments. How do we really assess and have attribution for the impact of various interventions that are beyond the pure clinical intervention? And that, to me, is kind of the future space that has to be defined. And what do you see as the platform where SAMHSA can help push that space? Because I don't see it a lot in the private sector. I hear them talk about value-based contracts and risk contracts, which all presuppose that they know how to address the needs of populations that can help them be more stable if they have a mental illness or addiction. But this is really tabula rasa in terms of, getting the toolkits together on this SDOH side that can complement the evidence-based practices that, we try to upskill around at PsychUp.
Yeah, I mean, it's right on. I mean, definitely the social determinants of health we know are so critical drivers of a lot of the equity patterns and trends that we see. And so some of what we're working on in this space is, for one, working with our discretionary grantees and really helping them to, right out of the gate, think about the populations that they're serving and think about, are there disparity populations within that particular grant topic? So if it's, let's say, for example, the Pregnant and Postpartum Women Initiative, and as part of that funding agreement, once they get the award, they have to develop what we call a disparity impact statement. So the disparity impact statement, they have to identify disparity populations and then indicate how they will address working with that population to reduce and eliminate disparities. Part of what they have to do is use the cultural and linguistic competence standards. So these are the standards that were developed out of the Office of Minority Health that in fact have been now updated. And now there is a behavioral health guide to the cultural and linguistic appropriate service standards. And so it's essentially 14 competency areas that if an organization or a program implements and use these competency areas, it should help to reduce and eliminate disparities.
Can you talk also about the Presence Initiative, which is to get all schools designated as site of service for delivery of mental health, which is not contingent on an IEP, meaning you can have primary and secondary and tertiary interventions that aren't triggered by an IEP, but could just be done on a population level?
Yeah, we've got definitely some grants that sort of fit both of our worlds, if you will. So, for example, our Project Aware grant, as you know, when Secretary Cardona was in Connecticut had one of these grants under his leadership, funded by SAMHSA. But Project Aware is a wonderful example of, the ways that we can continue to collaborate and sort of expand the work. So that is an initiative where states are funded to work with their state education authorities to essentially implement programs within schools that are about identifying kids that may be struggling, about increasing awareness and providing education and training to school personnel, but then ultimately connecting students to mental health services and supports, or behavioral health services and supports, and connecting families more broadly as necessary as well. And so just that funding initiative alone, which we've increased through with ARPA funds recently, that's one area that I'm interested in and excited about us having conversations around. I think it's so important, as we know, to connect kids early on when they're struggling to services and supports. And within school settings, we know schools are a vital environment to be able to do that. Teachers see students daily. And so that can be one area where students can help get connected to services and supports, particularly if the teachers and the school setting and personnel experience and receive training around how to identify students that may be struggling.
So I hope our listeners could get a real appreciation for the multifaceted role you're playing kind of as a coordinator for mental health across all these federal agencies where you're the lead as the mental health designate. To conclude, could you talk a little bit about the impact of the racial pandemic concurrent with the COVID pandemic and what it has meant to you as someone who's dedicated your life to trying to end these microaggressions and, trying to address systemic racism and help people understand where it really, unfortunately, is. Unconscious bias is much bigger than ever anyone really appreciates.
Yeah, unconscious bias is very real. And so what it has meant for me and what I've seen is just increased stress for diverse communities, but ultimately for all communities, as well as what we've seen related to COVID. And so it just speaks to the need for the importance of self-care, for people to really practice self-care. Also for individuals, if they see a family member or a friend or somebody who's struggling, to reach out and to connect, to let them know that services and supports are available. We've also seen increased rates of suicidal ideation among diverse communities. And so it's important now more than ever for people to keep connected, to help connect loved ones or families or friends or even oneself to services and supports if an individual is struggling. Help is available. Recovery is real and possible.
I feel like we could talk to you all day. It's actually pretty sweet. Patrick just sent me a text and said, you better cut me off because I could just talk to her literally all day. So I think this is so fascinating. Before we end, you have this incredible wealth of knowledge and background. So I think we're all so lucky to have you in the position, but I bet you've seen a lot, done a lot, experienced a lot. Do you have any sort of lessons learned or any kind of tips that you can give our listeners who are in, situations, whether in payers or hospital systems or health systems or community systems that are also trying to move mountains?
Yeah, I would say definitely keep at it. And if it's, individuals or families, it's often important to be your own best healthcare advocates. If you're struggling, certainly work to connect with services and supports. If you have questions about coverage, certainly reach out. There are resources and supports there. Go to the SAMHSA website, or even many state websites will have information about connecting to services and supports. But I think that the biggest thing is I think it's important for folks to know just that, recovery is real and recovery is possible and help is available.
Thank you.
Thank you, Madam Secretary. You're a tremendous public servant. You could be doing a lot of other things, making a lot more money, but you're really making a difference, most importantly. And I hope you feel a sense of satisfaction at all the help that you're giving to so many people through your leadership at SAMHSA.
Oh, thank you. Thank you so much. And thank you for having me on and for all the amazing work that you're each doing. I think shows like this help to raise awareness, help to address stigma, and help to give people hope. So thank you for the work that you're doing as well, and for having me on.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.